Hi, I'm Sandy. I'm here to talk to you a little bit about getting my new teeth. I just got them about 4 months ago, and there's good, bad, and indifferent. And let's talk a little bit about good and bad. One of the bad things is that you're going to swell. Your face is going to swell. In my case, I actually had some black eyes for a little while, quite some couple of weeks there. I looked like I'd been in a fight with Mike Tyson, and I lost. But the truth of the matter is that they begin to heal quickly. I was able to use a little makeup to cover. Now, if you're a man, you may not have makeup to cover, but it will go away very quickly. Now, you think about the bruising, and usually there's a lot of pain dealt with that. I did not have a lot of pain with it. It is natural because I had major dental surgery to have bruising. So don't be afraid of what you see when you first come out of surgery. It will only last for a couple of weeks for the initial swelling to go down. The bruising depends on your skin type, what kind of life you live, the thinness, your age. If you're younger, it won't take you long for the bruising to go away. If you're older, it might take a little bit longer. I'm 72. And it took me probably a good 2 or 3 weeks before the black started going away. So don't be afraid of that. I was not in pain. Yeah, I just looked worse than I felt. Many times when you have temporary teeth or you're getting an implant, some of my friends have got implants at 1 or 2 teeth at a time. And in that case, they're giving a temporary cover, a case, a crown, as you will, over that temporary tooth. But not with these. Not with these. I have a full set of mouth. These are the very teeth that they put into my mouth right after 24 hours. I didn't have to wait to get another pair later. These are my teeth from the very beginning. These will be the teeth I will have for the rest of my days. I don't have to wait 6 weeks to get the crowns taken off and a new pair put on. These are my permanent teeth from 24 hours after my surgery. These are the same set of teeth that I got that day. The first 5 days I had these teeth, I bit the inside of my mouth quite often. It was very painful because these guys are very sharp. That's good news. But it was a kind of a learning experience to know when to close your mouth and how to close your mouth. You do have some swelling after surgery, so that will make it a little easier to bite the inside of your mouth. So be patient with yourself. Take your time. You have to learn to open your mouth and close your mouth slowly so that your teeth get used to knowing where your gums are and where the inside of your cheeks are. So that's one of the hard things to learn, but it doesn't take long. I own my own business. I'm a massage therapist. Thank goodness most of my job is done in the dark, so nobody was able to see that I couldn't smile. But now I can greet my clients with a big smile and show them how grateful I am to have them there. I do networking. I'm able to go to luncheons and to breakfast and have business meetings and sit and talk with confidence. Confidence I haven't had for 20 years. Now let's talk about one of the most serious problems that I had during this set. And it was that I looked around at all kinds of options. I went to all kinds of people, neurosurgeons, oral surgeon, excuse me. I went to an oral surgeon to have priced out. I went to a couple of dentists and asked their help and instructions. And then I went to Nuvia. And I was surprised. Nuvia has a cost guide, and it made things more attractive to me financially. So if you're looking for cost and what you want to do with your budget, there's a cost guide attached to this video. Take a look at it. I think you might be really surprised that what you can do and how quickly you could get that done. Now, believe it or not, one of the good things that happened was a surgery. Now, I don't know about you, but surgery is not something I like to have every day. But I was really surprised, one, that the surgeon who was going to do the work actually sent me a video introducing himself to me. And so I would know who this person was. Two, I was introduced to the anesthesiologist who actually called me the day before surgery to explain to me exactly what they were going to be giving me, how long I would possibly be under. I was completely asleep. I was not aware of anything. They said goodnight to me, gave me my little shot of good stuff, and on to sleep I went. And when I woke up, surgery was finished. So they were very careful not only to tell me who my surgeon was. I was introduced to the anesthesiologist, and they introduced me to my dentist, who would do the final adjustments for me. Now, they're going to ask you to wait 4 months before you have any really hard things to eat, like apples or steak, which I love. But most of the things that you're going to eat are considered soft foods, like pastas. And I had Frito pies I made with making sure the Fritos were chopped up and nice and soft when I ate them. So you got a ton of things to eat. The screws that they put into the bone so that they connect the teeth to them. Okay? Why does that take 4 months? Just like you have a broken bone, you have to mend. So once they screw these screws in, they need time for the body in the jaw to grow calcium around that screw so that it is stabilized. So once it's stabilized, you can eat whatever you want to. It's now part of your body. Your literally body grows around that screw so that they're now secure. So you don't have to be afraid of what you eat. I wanted to make this video for people who were like me, who were afraid. They didn't know what was going to happen, what the process was. Could they really do it in 24 hours? What's going to happen to me? I wanted you to know how this process goes about, how to be brave, and answer any questions you may have from prior to the surgery, during the surgery, after the surgery, and the few months that you have to heal. I wanted to know, and there was no one to tell me. So I'm here to help you walk through this slow and easy. And that's why I made this video for you.